culture influences beliefs about how to prevent and treat illness and what constitutes good care. More specifically, it influences how each person experiences and responds to pain. By virtue of belonging to multiple cultural groups, each of us has a unique cultural perspective. Nurses must embrace this crucial point in order to provide patients with culturally acceptable pain management. In this scenario, there's language and interpretation problems. Successful pain management and education is contingent upon effective communication. Language and interpretation problems can be a barrier to effective pain management. Nurses can prevent patients from different cultures who speak different languages from suffering pain with effective communication. In this scenario, the nurse Jennifer is taking care of a Spanish-speaking only patient who does not speak English and is one day post-op knee replacement. The nurse's lack of cultural sensitivity is a barrier to effective pain assessment.
Good morning, Miss Maldonado. My name is Jennifer. I'm going to be your nurse today. Are you having any pain?
Tengo mucho dolor.
No, pain. Are you having any pain?
Me duele
Any
mucho.
pain? Like, ow?
The nurse should have secured an interpreter for the patient who is not proficient in English and ask her about cultural therapies that might have been helpful.
Oh, I see here that Mrs. Maldonado is a Spanish-speaking only patient. You know what? I'm going to get an interpreter for her. Hi, this is Jennifer on 6 Northeast. I'm going to need a Spanish-speaking interpreter for my patient, Mrs. Maldonado. Great, thanks. So I have a patient here. Her name is Mrs. Maldonado, and she's Spanish-speaking only.
Okay.
I'd like to ask her about her pain.
Okay.
You ready to go into the room?
Yeah.
Let's go. Hi, Mrs. Maldonado. I brought an interpreter here for us, okay?
Me llamo Vera, soy la intérprete.
Are you having any pain, Mrs. Maldonado?
Su enfermera quiere saber si tiene dolor.
Sí, tengo mucho dolor.
She's saying she's having a lot of pain.
Are you, where is your pain?
Miss Maldonado, ¿dónde tiene dolor?
Tengo el dolor en la rodilla.
She's saying it's on her left leg where they did the surgery.
Okay. Can you describe the pain for me, Mrs. Maldonado?
¿Me puede describir cómo es el dolor que siente, Miss Maldonado?
Sí, es fuerte el dolor, mucho, fuerte.
She's saying it's a sharp throbbing pain on that leg.
Okay. You know what? I have a chart here that I would like to ask her where her pain is on a scale of 0 to 10, and it's in Spanish.
Okay. Miss Maldonado, del número 0 a 10, ¿me puede decir su nivel de dolor?
8, el 8.
She's saying her pain is an 8.
Okay, all right. I'm going to get you some pain medication, Miss Maldonado, okay? And I'll come right back in a half hour to make sure that the pain medicine works, okay?
Su enfermera le va a traer medicina para su dolor. Después que la enfermera le dé la medicina, regresa en 30 minutos para ver si tienes menos dolor, ¿ok, Miss Maldonado?
Okay. Muchas gracias. Muchas gracias.
Effective communication with patients whose language differs from your own are the use of interpreters and translation services.
People from cultures who value Stoicism tend to vocalize with moans and screams when they are in pain. They may strive to keep their faces masked through facial grimacing. They may feel that they'll be perceived as weak if they admit to or show pain, and they may deny having pain when asked. They may often prefer to be left alone to bear their pain without bothering others. In this scenario, the patient is of Asian culture where Stoicism is valued. The nurse lacks knowledge of cultural differences of expressing pain.
Good morning, Mrs. Pye. I'm Jennifer. I'm going to be your nurse today. Are you having any pain?
I'm okay. I'm okay.
No?
Yeah.
You sure? All right. See you later.
The nurse should have incorporated the LEARN model, which is a mnemonic for listen, explain, acknowledge, recommend, and negotiate. This model improves communication, which improves pain outcomes, as demonstrated by the next scenario.
Good morning, Mrs. Pye. My name is Jennifer. I'm going to be your nurse today. Are you having any pain?
I'm okay.
You know what, Mrs. Pye? I can see that you're uncomfortable. Can you tell me what you're feeling?
I'm okay.
You know, it's very common for patients who have pancreatitis to experience a lot of pain. And if you are experiencing any pain, I'd really like you to let me know so that we can do something about it. Okay. You know that pain actually will slow the healing process, and it increases your discomfort. And there are many ways that we can help alleviate your pain.
You know what, Jennifer? Actually, I'm in a lot of pain. I think I need pain medication.
On a scale of 0 to 10, what do you think your pain is?
Around an 8 or 9.
You know what? We'll get you some pain medication, okay?
Okay. Thank you, Jennifer.
Although the wishes of patients with these beliefs must be respected, nurses still need to provide them with information that will allow them to choose whether or not to accept treatment for their pain.
You know what, Jennifer? Can I have a cup of water?
Sure, no problem.
And can you hold the door behind you?
I got it.
In some cultures, different methods such as acupuncture, meditation, coining, and herbal teas are used for management of pain. Coining is done by Vietnamese folk healer by scraping a coin over a patient's oiled back, which is believed to release bad wind, which is believed to be the cause of the patient's illness. In this scenario, Miss Wynn is a 68-year-old woman with a history of stroke who was brought into the ER by her daughter, experiencing chronic back pain for several months, and has been treating the pain with herbal tea, meditation, and coining.
Oh, my back! Jennifer! Jennifer, where's my
what's
herbal
wrong?
tea?
Oh, we don't have any of your herbal tea right now, Mom. We're in the
But my pain,
hospital.
my back is hurting me.
I know, Mom. I know.
How about, where's the coining? I'm gonna do coining now.
Why
I'm gonna
is-
do
no, we
coining.
don't have any
Where's the
coins.
coining?
We don't have any coins, Mom. Here,
I need
you
my-
know what? Sit down. I'm going to go get the nurse, okay?
Hurry!
Nurse, my mom, she's in a lot of pain right now.
Oh, okay, I'm going to go right in.
Okay.
Hi, Mrs. Wynn. Are you in pain?
What do I look like?
Would you like any pain medication?
No, I like those pain meds. Those give bad energy.
Well, you know, with pain, when you don't manage your pain, it can cause increased discomfort and actually alter your healing process.
But I don't like pain meds. Where's my tea?
Well, you'd be good. I'm glad to hear that your herbal tea is okay to take with your medication.
Okay.
So it was checked with the pharmacist by your doctor.
Okay.
Well, you know, your daughter Jennifer, she mentioned that you use coining as for
Oh
pain.
yeah, every day.
Well, you know, you're on Coumadin and it's a blood thinner, and with
What?
the use of coining, it increases the risk of bleeding.
What? You didn't tell me this. I don't wanna bleed.
Yeah, so while you're on this medication, you shouldn't do coining.
Oh my God.
And Mrs. Wynn, I read in your chart that you do meditation.
Oh yeah, I do meditate. I go.
Okay,
you
you
know.
That's actually really good because it's evidence-based practice of
Oh.
effective pain management.
Well, where's my tea? I still want
Okay.
my tea.
Well, I guess, you know, your pain medication, it actually comes in liquid form too. Here's your tea, Mrs. Wynn, with
Okay,
your
thank you.
medication.
Thank you.
All patients have a right to effective pain management. Understanding the influences culture has on patients' pain experiences and attitudes regarding treatments will permit nurses to achieve better pain outcomes for all of them.